The following program is sponsored by Frankie Boyer, who is responsible for its content. Before beginning any health or fitness practice, consult your personal physician.
You're heading for a breakdown. Why don't you pull yourself to pieces?
Keeping you healthy from coast to coast, this is the Frankie Boyer Show. Frankie Boyer Show.
There's some very strange people practicing medicine these days.
This is the Frankie Boyer Show.
Medically impossible.
Your voice for healthy living.
And welcome. It is Frankie Boyer. This is 50,000 powerful watts coming at you, WCRN, 8:30 a.m. on the dial. And I am so excited. When I got my book in the mail, I just was jumping up and down because how many of you out there, and I know so many of you, are suffering from those chronic, nagging coughs? Well, there's a new book out. It's called Cough Cures. It's the complete guide to the best natural remedies and over-the-counter drugs for acute and chronic coughs. And joining us today is the doctor that co-authored this book, courtesy of our good friends from Clear Sinus Nasal Products. And Dr. Ferrer is with us. And Doctor, I'm crazy about this book. This is so much needed. I've never seen a book like this before, and welcome to the program. We have to just tell everybody that you are an experienced pulmonologist, trained both in Cuba and the U.S., founder of the Cleveland Clinic Florida Cough Center, president of the Intensive Care Experts based in Weston, Florida. You're an authority on respiratory ailments with more than 20 years' experience. You grew up in a culture that effectively utilized herbal teas and folk remedies for coughs and colds. And so it's just such a perfect combination, taking the blend of the Western and all the naturals for this new book. Congratulations and welcome to the program.
Well, thank you. Thank you for having me. It is a pleasure to be here with you.
So I have to ask before we get into the book, how did you wind up here in the States, Doctor?
Well, it's a long story, but I'm going to try to make it short. I grew up in Cuba in the hillsides of Guantanamo, a small town, about 700 people. We are farmers, and we don't have doctors. My grandma was basically the doctor of my town. When I reached, I think around the age of 12, the Cuban government sent us to boarding school. So I went to a boarding school, and for my boarding school, I finished my high school there and went to med school, pulmonary training in Cuba. And at the end of my training, I was hired by the United Nations, and I led a group of researchers through the Orinoco River in the Amazons for a couple of years. From there, came to the States and going to residency in Texas and fellowship again at George Washington University in GW, and from there to the Cleveland Clinic.
Wow, that's quite a story. By the way, everybody, we're giving away 5 copies. The doctor is so generous. He's giving away 5 copies of his new book, Cough Cures. And the number, the first 5 people that call in at 508-871-7000 will get a copy of the book. And Cam will tell us when we have the 5. So it's only 5, but that's awesome. That we're grateful for that. 508-871-7000. You know, here we are, as you know, studying and practicing medicine in foreign countries, and you begin your book with such a compelling story that I think every single person listening to this program can relate to. You begin the story, the book, with a story about a mother who is dealing with 2 kids, and she wakes them up. They don't want to get up. One of them was up most of the night coughing. And this story, and it goes on about the rain, and one of them has drops one off to school. The other one has a fever and can't go to school, the older one. and she keeps the older one at home, and it's like this list of things that could happen to anyone listening to this program they could relate and understand. What makes this story so compelling is that, tell everybody who that person was in the story.
Well, it's actually my wife, and she's the inspiration to most of the things that I do in my life. She is my everything. But my wife I was actually retraining in pulmonary medicine at GW when my wife was taking care of my kids, toddlers, and those years when they're coughing, seems like every week. That was the story, and she was the inspiration for the book, because every time I got home, she has something from the pharmacy that I knew. The research has proven that all these over-the-counters are not good.
Right. Natalie has a question for you, Doctor. Hi, Natalie. And Natalie, did you give your name to be one of the 5 winners of the book?
Yes, I did.
Okay, good, perfect. What's your question?
I had the cough now for a month. It's getting a little bit better, but I still have it every morning. A lot of mucus coming up.
Okay. And this is the first time?
No, I had cough before, but this is more severe.
I see. Well, usually, most of the coughs that they go beyond 3 weeks, usually after an acute episode of viral infection or something like that. This kind of cough are what we call prolonged acute cough. They're usually not a chronic cough, and they're usually from postnasal drip.
Okay.
So, combining some natural remedies, we talk a lot about the Clear is an incredible nasal spray that it has.
It really is.
A combination of saline and
I've been using that, and I'm getting a little bit better.
That's excellent. If you don't have any other symptoms that are alarming, we have those symptoms in the book, like, significant shortness of breath or wheezing or chest pain.
Just the plain cough.
Well, this is, we have actually a compelling list of natural remedies that you can use right away. There's a summary chapter at the end of the book that you can use right away for this kind of cough, and they're highly effective.
Okay. Thank you so much.
Thank you, Natalie, and we'll get you out the book as soon as possible. Doctor, why is it that we, in this country, more so than in your country understands the need for the herbals and the teas, we run to our doctors and to practitioners because we want antibiotics. But the truth is, antibiotics are never going to work for coughs and colds. Or are they?
Well, that's exactly right. Most of the coughs are viral, and on antibiotics, they do not work for viruses. Unfortunately, if we go back to the history of medicine in America, 100 years ago, we used to just treat with natural remedies those acute coughs for the most part. When the antibiotics came to the scenes and to the era of medicine in the 1940s and 50s, everything started shifting there. So we start going more to the doctor. We have insurance. We have pharmaceutical industry, and more people start going to the doctor, and that is the story when it shifted, and we start using more prescription medication and antibiotics. Antibiotics are just as you said,
and
they don't work.
Doctor, I have to ask you, because we think that these over-the-counter medications are not harmful to us, when we just had on one of the energy twins the other day, Judy Zucker, who wrote a book called The Memory Diet. And she talks about her mother taking something as simple as Benadryl, but her mother overdosed on this Benadryl for so many years and took so much of it that they're afraid that it's the reason why she has memory loss today.
Well, that's exactly right. Unfortunately, we have lots of side effects that they are not revealed to the public. They are there, and research backing this up. Benadryl is one of those. And, it's been linked to dementia for sure. Liver failure induced by Tylenol, what acetaminophen that is in almost every single over-the-counter for cough is available today, and is the number one reason for liver failure in America. Cough suppressants are being used by teenagers to get high. They combine those with soda and alcohol, and it's a powerful drug. It's estimated that 1 in 5 teens knows somebody that is using one of those over-the-counters to get high. So, unfortunately, most of these over-the-counters that we have for cough and colds, they're not effective, and they have a lot of toxic side effects.
By the way, Dr. Ferrer's book is called it's called Cough Cures: The Complete Guide to the Best Natural Remedies and Over-the-Counter Drugs for acute and chronic coughs. And if you want a copy of the book, did we already do all 5? Are they all gone? Oh, they're gone. Okay, I'm sorry. All the books are gone. They went quickly. They went quickly. They're like hot potatoes, those books. Oh, my gosh. But you can get a copy on Amazon. It's a great book. It's one of those books you want to have in your library. This is one of those books that you just really want to get because it talks about the top natural holistic treatments that are safe, that aren't going to be harmful to you or your liver or your family or your children. Because, doctor, you start out your book, Cough Cures, talking about your wife, and she was going to give your child a medicine that was not really appropriate for your child, and it expired.
That's right.
So, we're not realizing that most of the medicines that are over the counter can be just as toxic and harmful to our kids.
That's correct. And the research backed that up. If we look into today, even, we see why Americans, and why in America we have so much asthma and many other conditions, and they've been linking those to, right there in Massachusetts, there's an ongoing study linking childhood asthma with acetaminophen. And probably diphenhydramine, which is the Benadryl, may have some role in that as well. So the evidence is there, and we've been using and abusing those medications because we believe that they are available over the counter. They don't have problems. They are not harmful, and they are.
Right. We need to take a quick break. We will be back in just a moment. If you have a question for the doctor, 508-871-7000 is our number. And we thank all of our listeners for winning the book today. But you can pick up Dr. Ferrer's book, Cough Cures, available at Amazon. And Clear Sinus Nasal products are available at Vitamin Shop, Whole Foods, Sprouts, other fine health retailers, also available at Target, CVS, and Rite Aid. For a complete list of retailers, go to clear.com. And we will be back in just a moment. Frankie Boyer right here on WCRN, 8:30 a.m. on the dial. That's WCRNradio.com. Stay tuned.
This is the Frankie Boyer Show. No, you can't say you only listen when you're homesick. You can't get sick. This is a health show, silly. Now more of Frankie Boyer.
And welcome back. It is Frankie Boyer, and the new book is out. It's called Cough Cures. And I know several people that have these chronic coughs that, and they're coughing, and they start, and it's maddening as a friend, quite honestly, because you know that it's annoying to them and it's annoying to everyone around them. But this is an opportunity to really get a handle on this. You should all get this book. It is called Cough Cures. You can get it on Amazon. And one of the products that's mentioned in the book is xylitol, which is what Clear Sinus Nasal products are made from. And it's a spectacular product, and it's available at the Vitamin Shop and Whole Foods and Sprouts and other fine health retailers, including Targets and CVS, Rite Aid. And Doctor, welcome back. It's such a pleasure. For those of you just joining us, he's one of the top pulmonary specialists in the country and runs the Cleveland Clinic in Florida at the Cleveland Clinic Florida Cough Center. And this book took years to make, and it's a very important book because it really delves into the topic of what people can do to help themselves with more natural remedies. And some of the things that you write about in the book are really perfect. And we have a question, though. One of our listeners has a question, and the question is, what would you recommend, doctor, for the flu? Her 97-year-old mother, God bless her, is in the hospital with the flu, and they're giving her Tamiflu. What are your thoughts on this?
Well, it's really hard to make a judgment just based on that, but I'm gonna do my very best. She's in the hospital. One of the things at that age we need to think about is she's having some sort of respiratory failure, which will change the whole picture of the treatment that we do. But Tamiflu seems to be effective for influenza A, one subset of influenza only, and is for a very short time period, that a short window that we have, just basically 48 hours to 72 hours after the initial event that the patient developed the symptoms. So if it was given during that window, is effective and it tends to help. Now, for the most part, when she goes out of the hospital or when she gets transferred out, she will have probably some cough and she will still have some mucus coming out of the lungs. By far, the great majority of patients, if they do not develop pneumonia, what they have is an upper respiratory issues, postnasal drip being one of those. We recommend in the book there is a homeopathic remedy which is highly, highly effective and highly steady, actually, Calibic. They can call some of the homeopathic practitioners in their area, and they are very familiar with this. It helps decrease the mucus and secretion and improve the cough and the symptoms in the long run. We also combine the clear nasal spray to help with the postnasal drip, and we have in the book some information charts that can guide them into specific things that they can do once the patient recovers from this acute event.
Okay, awesome. Thank you so much. What's the how soon should we treat this? I mean, when do we realize that this is more than just a cough and go to the doctors? Or what are your thoughts on that?
That's a great question. By the way, in the book, I have a summary table for that, and I have a chapter dedicated to that. Because I think this is one of the things that we as a doctor need to teach our patients and families the most, is when can you treat something safely at home and when do you have to go and see the doctor. Fever, persistent shortness of breath for more than 3 days, significant chest pain, large amount of mucus coming out. Those are symptoms that tend to be alarming or red flags, and those are the things that triggers that we should go and see the doctor.
Okay. This book gets into everything. You really, the actual remedies in the book worth the price of admission, from tea tree oil. I mean, you have listed vitamin A, the slippery elm, all of the things that it's all chamomile, all of it in one book. The research evidence for the herbs and supplements is worth the price of the book itself. Quite honestly, it really is. And Dr. Gus, you want us to exercise daily. You want us to really and truly understand that if this is a chronic problem, can we expect it to go away overnight? How long should it, if it's chronic and it's been with someone for a long time, how soon can they get relief, in your opinion?
It will depend on the cost. If we look at the top 5 most common reason for chronic cough, excluding costs related to smoking, which is a different subset of issues. The top 5 most common reasons, number 1 is related to postnasal drip. With an effective plan, most people can find relief within a week. Acid reflux, by far, continue to be one of the most common reasons. Heartburn is what we're talking here, is one of the most common reasons for chronic cough, and it can be treated effectively with natural remedies and changes in diet, and people can find relief and results within a week. Other reasons for chronic cough, there are medications for blood pressure, which are very frequently prescribed, that produces chronic cough, and it doesn't go a week. When I found one of my patients with that one of those medication, and you stop it, and within 48 hours the cough is gone. And I have seen people coughing for months and months with those medications.
Oh, I love it.
And
this is a great book, by the way. The book is available at Amazon, Cough Cures, and the Clear Sinus product that the doctor recommends in the book, and one of his little call for action that really helps people, and I swear by it. I love that Clear, and you can get that at Targets, at CVS, at Rite Aid, at the vitamin shops, at Whole Foods. So it's available for people all over. It's easily available. But if you want the book, though, and thank you for the 5 winners. We thank you for calling in. The book is available on Amazon. And, Doctor, you just are wonderful. We're going to have the doctor back again for another interview, because this was just not enough, because we really need to get people off those harmful over-the-counter medications. They are not good for any of us. They do a lot of terrible harm, and we have to really continue to talk about them. And thank you so much, Doctor. What a pleasure having you with us today.
My pleasure. Thank you.
And we will be back in just a moment. Frankie Boyer, WCRN, 8:30 a.m. on the dial.